So we're going to talk about finding a key rib. So what do I mean by key rib? Well, key rib is if there is potentially, it's not always a single rib. Sometimes it's like 2, 3, 4 ribs that are just kind of all stuck together. But if there is a single rib that has shifted for whatever reason, whether it be where it attaches to the spine in the back or where it attaches to the sternum in the front, typically the rib is either shifted. I mean, you could get specific and talk about torsions, but let's just say that it's relatively closer to the rib above it, or it's relatively closer to the rib below it, okay? And so if it's relatively closer, let's say this, if it's relatively closer to the rib above it, then we want to try to like pull it away from that rib. And whereas if this is the key rib and it's relatively closer to the rib below it, then we want to try and move it away in the superior direction, okay? So it's kind of identifying that. And still all the soft tissue considerations apply. If we find a key rib, then we want to do the soft tissue work, the bony contours between the ribs, work on the intercostals. And then to actually mobilize the rib, I'll go through that process right now. So to find a key rib, however, you want to come on the side. The lateral border is just the easiest place to access a key rib because it's kind of the midpoint between where it attaches posteriorly and where it attaches anteriorly. Now, if I sink on, I am literally just going to come and feel rib spacing. Okay, so I'm on a rib, I sink down and then rise back up on the next rib. I just want to feel what the space is between that rib. Then I go up to the next one, feel what the space is there. Go up to the next one, feel what the space is there. And like right here, it's going to be impossible to see on the video. You're just going to have to feel it for yourself. But right here, there's like, the ribs are compressed on each other. There's like no space between each rib. So if I come down below that and feel what the space is like there, it's like there's some space there, but it's not a ton of space. And then I go on to the compress and go just above. If I go above, I'm like, oh, all of a sudden I feel like I'm like floating around in a sea of nothing. I don't know if that's appropriate to say, but basically it feels like there's this much larger gap. And so using the reasoning that I just mentioned, right now I'm feeling like the space below, let's say this is my key rib, the space below is here, or the space below is like a normal amount of space. Then we have 2 ribs that feel like they're stuck together, and then the space above is larger, okay? So that tells me that I want to get that key rib to decrease that excessive or larger space. So I need to mobilize it superiorly. All right, so I'm gonna get on that level right there. And so, no, right there. And so I want to mobilize it superiorly. So I'm just gonna kind of line my fingers up along a broader contact border of that rib. I'm gonna sink in there. And then Kelsey, just go ahead and breathe in and out. So as she breathes out, I'm blocking it from coming down. And as she breathes in, I'm following it up. So it's kind of similar to the general technique in another video that we did, and breathe in, but it's more specific to just one single rib. We're thinking, what would give us the most bang? What would give us the most bang for our buck? Or what's like the one thing we can do potentially to make the biggest difference in the system? Okay, and the more specific we can be with that, the better. All right, so this is kind of the least aggressive way to work on this. I could also have her take her hand across her head and do a little upper extremity basking seal where I take the pillow away and then, yep, stay neutral there. And go ahead and breathe in, raise up into my hand a little bit. There you go, and I'm blocking it, and then breathe out, lower down. And her head must stay heavy. There you go, into her hand, and breathe in, raise up a little bit. I'm blocking it from coming down. And then as she breathes out, head's heavy, I'm just following that rib down. Okay, and breathe in, come up. Good, and out and come down. Good, okay. So that is just another option for if it's not moving as well as you would like for it to move, you can add in where the body can actually help you raise that rib up with a little bit more input from your fingers, okay? So that would be assessing for a key rib and then treating the key rib in the direction that it needs to go.